Now, many parents think that autism and speech delay are the same thing, but they are not. First of all, autism, it involves different parts of the brain. The motor cortex is affected, the frontal lobe, the temporal lobe, where we have understanding, language understanding, and sound. And also you find the limbic system is also affected. This is not the same case with speech delay children. Speech delay children, in most cases, the only problem they have is just expression and speaking. They can relate emotionally. They're able to respond to name. The only problem you find they have is just speaking words. Let me give you simple difference which will help you to understand whether your child is autistic or speech delay. Let's first look at hyperactivity. This can be your main reference to know whether your child has autism or has speech delay. If your child has hyperactivity, this is one of the signs that your child might not be having just speech delay, and instead it is autism. Because speech delay children, they don't have hyperactivity. Another example, it's social connection. Speech delay children, in most cases, with the many children I've seen, they don't really have any problem with connecting with others. They can relate, they can respond to name, they can interact with other people. But you find, in most cases, instead of speaking, they prefer to use gestures because the words are not coming out. And even when you look at the parts that are affected for speech delay children, it's mostly the temporal lobe and the frontal lobe. Whereas for children with autism, it's not just temporal lobe and the frontal lobe. You find cerebellum is affected. That's affecting timing and coordination so that speech can come out. You find the limbic system is affected, and that's why the child is not able to communicate with others and interact and is always alone. So you find the emotional side for children with autism is affected. Whereas for speech delay children, in most cases, they are not always in isolation. You find he's always playing with other kids. There are many signs here which you can look and see whether your child has got speech delay or has got autism, because by understanding what the problem that your child has, you now know what kind of intervention. I've talked a lot about in this book why your child understands but doesn't speak. Because by understanding the problem that your child has, now you get to know what kind of intervention do I need. Because if your child has speech delay and he doesn't have autism, and then you take him for, let's say, I don't think a speech delay child needs occupational therapy. Maybe he may need a speech therapy, but he doesn't need an occupational therapy because he doesn't have any problem with, in most cases, they also don't have toilet training issues. Yet for autistic children, they have. Now, let's look at the parts affected in most cases for autistic children. First of all, there is the frontal lobe, where we have speech production and planning and expression. There is also temporal lobe, where we have language understanding and sound processing. There is also cerebellum. This is also affected in autistic children, where now this part of the brain is going to help the child to know when to talk, when to stop. So the cerebellum is going to be controlling mouth, tongue, and breathing muscles in order for the child to speak. So for an autistic child, this part is affected. And another part which is affected is the limbic system. And that's why you find he's always in isolation and the social interaction has become a big problem. Yet for children with speech delay, this is not the same case. So as a parent, knowing that your child, the problem he has is not autism, instead it is speech delay, then the whole thing changes. Even the attitude you had on your child changes. I've talked a lot about how the child might have speech in his brain, but now the problem becomes expression. Maybe the problem is with the body which is not responding very well. And this is normal. Now, when you stop looking at your child as someone who has got a problem in his brain, it helps you to actually help him, because now you know, my child's brain is okay, but the problem is expression. So, if you've been getting intervention for your child as someone who has got a problem in his brain, yet your child, the problem is just, I've talked a lot about how the child might have speech here. In the temporal lobe, the language has been processed and sound. In the frontal lobe, even the speech has been formed. But now here, where the signals now passes through the spinal cord in order to branch and reach on the mouth and tongue and the jaw, you find the signals get interrupted here. So if you give your child intervention in an approach whereby you are trying to fix the brain, yet the brain is not the one that has the issue, and in most cases, 90% of the children that have received, you find in most cases, they've got information, they've got the message they want to pass on. And that's why most of them, they prefer to point when they want to communicate. So for that child, if the brain is not the one with the issue, and now the problem is the spine, and you've been trying to fix the brain, then you've been using the wrong approach. There is this parent I talked to some years ago. He had, the child was understanding, but speaking was a problem. And he was not in the country whereby he could come for therapy, for Kunga therapy. So I asked the parent to try physiotherapy for the back. And actually, the parent told me they got some improvement with speech. So, understanding the real issue behind your child's speech delay, understanding it clearly, it helps you to now look at the problem in another angle. It now helps you to look for real answers, and answers which are going to really solve the problem that your child has got. So, with these signs, I hope now you understood, you can be able to tell whether your child has autism or speech delay, and by understanding this, you are going now to be able to know how to help him. Now, some parents come and tell me something very emotional. They tell me, my child used to say mama, used to say daddy, used to say water, but all of a sudden one day he stopped talking any of those. And since then he hasn't talked. And of course it feels sad. And when they are telling you that, in most cases you can see they are very sad because of that. But I have good news for you. The good news I have for you is because the brain, it shows that the brain had already formed communication pathways. What am I talking about? What am I saying by talking communication pathways? What I'm talking about shows the brain had already made interaction between these different parts of the brain that are involved into speaking, even the body, even the nervous system. Here I'm talking about the frontal lobe, the temporal lobe, the cerebellum, the nervous system, and the body. It shows there was communication, there was coordination, and all of a sudden it stopped. You would ask yourself, why did it stop in the first place? We are created differently, and even our bodies are different. So there are children who are born with a vulnerable nervous system, which is already weak. And by chance, you find when he was 6 months, when he was 1 year, he was introduced to too much screen. And of course, our eyes are one of the things that takes high neurological energy among all other parts of the body. So by using that high neurological energy with the nervous system, which was already vulnerable, it reached at a point where the nervous system couldn't keep up, and then the communication stopped immediately. So as a parent, the first thing you need to do if your child is still using using phones and TV a lot, stop it immediately. The second thing you need to look at is attention. the reason why he might not be communicating very well, you might find that his attention has greatly reduced. So here I'm talking about the frontal lobe. And what are the things can you do at home to actually improve this, to actually improve his attention? You can engage your child in play. Like I've talked a lot about different exercises and sport like football and others. But also you can bring your child here to Kunga therapy. Kunga therapy is one of those therapies where it can help improve attention to the high levels. Because like I talked a lot about this, there are children who are not able to speak because they lack attention. There are children who are not able to speak because the processing at the temporal lobe is taking too much time. But when you do Kunga therapy, the processing now starts going quickly. The attention now improve. And this is something that not happens in a year or 2 years or 3 years, in weeks. So if your child was talking before, but now he's not talking, good news, the brain had already made communication pathways. So you just need a little push with Kunga therapy, with other therapies you are using, but don't stop intervention. Because when you stop intervention, the speech is not going to come back. So you might find the reason why he stopped talking is because of his lacking attention, or nervous system is not coordinating well, or the body and brain are not communicating very well. So by now supporting the nervous system, by improving this body and brain coordination, like I said, your child might attend therapy and in 2 days the children start talking. We get children, there's a parent who gave us a testimony. The child talked on the first day of therapy. It's not because the therapy was done maybe in a way that was so powerful compared to the other kid. In most cases, you find the system was ready. It just needed a push. So as a parent, if your child has got regression, it is called regression. He was talking before, but now all of a sudden he stopped talking. The answer is not just stopping completely. Because by stopping completely, by not giving him any intervention, you are not going to cover this speech. But by giving him intervention, improving this attention, improving coordination, improving body-brain connection, now the speech is going to come back very quickly. But also, at home, try to do things which are going now to contribute to this communication increase. Encourage social interaction. Encourage social interaction. Try to involve him into playing with other kids. And also, when you are talking to him, try to interest eye-to-eye contact. Because also these children, in most cases, you find they also lose eye contact. The way the communication stops, the eye contact goes, the attention goes, and even hyper start coming. Because hyper, attention, they are all from the same part of the brain, the frontal lobe. But now, by involving your child into praise, involving him into social interaction, trying to encourage eye-to-eye contact, this one might help him actually recover his speech, but also stopping screen time before everything else. And also try to give him these types of food that we've talked a lot about, bananas, which are able to increase that neurological energy, and things containing omega-3, omega-9, omega-3 fatty acids like fish, especially sardines, omenas, pumpkin seeds, eggs, avocados. So by doing all these, you can be able to improve, you can be able to bring back his speech. But also you can bring him here at Kunga therapy, just a month or two. And then by improving this attention, by improving this coordination, by improving this body-brain connection, your child can be able to speak again. Now, some parents are being told, relax, your child will speak when he wants to. But sometimes the problem is bigger than just speech alone. Parents, I'm going to give you 3 signs that the problem is not just speech. The problem might be something else. And the area you act with the neuroplasticity as the peak, you can be able to help your child and avoid the future problems, which might arise in getting late to get your child for intervention. I'm going to give you 3 signs that this is no longer just speech delay, and this might be something bigger, which should be taken care of as earliest as possible. 3 signs. Your child is lost in screen. You find your child, unless you give him phone, unless you take him in front of the TV to watch cartoons, you not get peace at home. This is a sign of poor attention, and this is a sign that your child lacks eye contact. So if your child is always craving for screens, this is one of the signs you as a parent, you should never ignore. Another sign, your child rarely maintain eye contact. If your child is not speaking, but even there is no eye contact there, parents never ignore this sign. And as soon as you act, the better. This is the second sign. Let me give you the third sign. Your child lacks focus and attention. If you can never take your child is 3 years, 4 years, but he can never maintain a conversation more than 2 minutes or 3 minutes, or even be attentive like other siblings of his, that's another sign that it might not be just speech delay, and it could be something like autism or any other problem, which you can be able to know when you take your child for assessment. Why do I keep telling parents to act as soon as possible? Because below 5 years, the neuroplasticity is at the peak. The frontal lobe is forming new neural networks. The temporal lobe is actively making new neural networks. So when you act, you get to help your child when some new neurons are being formed. So any intervention that is done at that time, it can yield bigger results and much more progress compared to if you would wait until it's 6 years old. So it's always not good to wait and hope, and this is the biggest mistake many parents make, delaying their children intervention, thinking that something will happen by chance, and it end up costing the children the best time they needed to actually make real improvement in speech. You see, speech, it's not just speech. It involves multiple parts of the brain and even our body to be able to speak. I've talked a lot about how cerebellum is involved. I've talked a lot about how breathing muscles are involved. We always look at speech as a brain making speech, but we forget that even our mouth, the way it is moving, you see my mouth is getting closed and opening. This is not being done by just the mouth. This is the brain working. So if the parts of the brain that is in charge of closing my mouth and opening it at the right moment is not working, I'll not be able to make speech. So if I cannot be able to have attention and have organized in my temporal lobe and have my frontal lobe make speech, then it's just not speech delay. Because speech, we say that the problem is speech delay when the problem is just at the temporal lobe and frontal lobe. But when the child has even problem with his limbic system, he has no social interaction with others, this is one of the signs that it's not just speech delay. And when you wait, you've seen these signs, there is no attention, there is no focus. The child rarely make eye contact, and you don't get him for intervention. Now the problem becomes bigger and bigger because below 5 years, anything can be done. I always tell parents, when I see a parent coming and he's got a child of 2 years, I always tell parents, let no one make you worry so much. Don't be afraid. Anything at this time can be done. But when children have reached, I've not talked a lot about this in my book, which I really want you to have, why your child understands but doesn't speak. A simple guide to brain-body communication and what parents can do. We keep saying these things so that you understand what's the problem that your child has and what kind of intervention do you need. So when you clearly understand the problem behind the speech, when you clearly understand that it's not just speech alone, or it's just speech alone, just speech delay. If he has eye contact, if he can maintain eye contact, his emotional side is okay, then your child does not have autism or others. But if he doesn't have eye contact, if he can rarely make eye contact, he doesn't have attention, those are signs that something might be bigger than what you thought it was. This shows that there is poor coordination between body and brain, which of course can be worked on. If you bring your child here at Kunga Therapy, this is what we do on a daily basis to improve that body-brain connection. And improving by this body-brain connection, children are able to speak in no time. So when you notice that your child, the problem he has is no longer just speech delay, the earlier you act, the better. You can be able to improve your child's focus, your child's attention, body-brain coordination, processing delay which he had at the temporal lobe, and even help him organize speech in the Broca's area if you act as earliest as possible. Below 5 years old, the neuroplasticity is at the peak and your child can be able to improve. Now, some children surprise their parents. He can remember YouTube videos, unlock phones, unlock TVs, even the laptops, but still struggles to make eye contact. Struggles to have attention. Struggles to communicate with others. This is because having strong visual memory is different from having communication pathways developing properly. And this really confuses many parents a lot. Many parents tell you, but my child is intelligent. Yes, the child is intelligent, but this is different from having eye contact, because for a child to speak, his frontal lobe has to be working very perfectly. It has to be communicating with the temporal lobe perfectly, because temporal lobe have to hear sounds and process language and then send information to the frontal lobe, so that the frontal lobe now can make speech, and the motor cortex has to send signals and they reach the nervous system, and the nervous system, especially the spinal cord, has to send now signals to the mouth, tongue, and jaw to now move so that the speech can be done. And this is what I keep saying. Having autism, or let me even say your child not being able to talk, does not mean that something is like his brain is impaired or something like that. Your child might not be able to talk, not because his brain has got a problem, but you find the problem is here in the spinal cord. The problem is here. So if the signals are not reaching or are getting interrupted while reaching the mouth and jaw and tongue, the child will not be able to speak. But he will have strong visual memory. If he sees a route, he will never forget it. If he sees some, there are children who can be able to watch a certain video on YouTube, he can watch it for 50 times. He can see your password today on your phone and tomorrow he can be able to unlock it. So for a child not being able to talk does not mean that his brain is impaired or he cannot do tasks that other children or other people can do. Because like I keep saying, your child might not be able to talk, not because his processing is delaying, not because at the frontal lobe the speech is not being made, but to find the reason why he's not being able to speak. the nerves are getting interrupted before they reach the body. And this is where Kunga therapy comes in, now to improve that body-brain connection so that now the speech can be flawless. So if your child is able to remember patterns, remember loads, remember your password for your laptop, that's not an indication that speech will just come by its own. That's actually an indication that the brain of your child might be working perfectly, but the problem might be communication pathways, especially the nervous system. The signals when they reach the spinal cord, and from there, either the body is not responding them well to the instructions, or even the signals are not reaching the body at all. So by understanding that for your child having strong visual memory does not automatically indicate that he will just one day speak miraculously out of nowhere, it helps you to get him for intervention while he's still early. Because below 5 years old, the neuroplasticity is at the peak. If you work on this body-brain connection, you can be able to improve the speech for your child. Because by him not having speech, at times it starts making him uncomfortable. And it builds frustration over the time. And this frustration might even push him into depression. And many children who throw tantrums, in most cases, with speech delay, you find they throw tantrum because he's got speech, he's got what he wants to speak, but the mouth is not moving to make speech. So by understanding that having strong intelligence, strong visual memory does not automatically indicate that the communication pathways are developing properly, it can actually help you to now seek for intervention while the child is still young. Because by that, you can be able to improve your child's condition. Now, many parents tell me something very surprising. My child ignores to his name, but he likes very happily and strongly to cartoons, songs, and some sound. Let me explain it clearly. You see, our brain, when it hears sound, it has its priorities. In most cases, the reason why you find your child might struggle to respond to their name, yet when he hears cartoon, is because the brain prioritizes those sounds which are more rewarding and sensory stimulating. So for him not responding to his name, it's not because he doesn't want to respond, it's because responding to his name is going to require a complex operation compared to hearing a certain song or a certain sound that he heard of a cartoon or something. Because when he hears a certain sound which he finds favorite, it stimulates the reward pathways. And also it causes the brain to prioritize that sound because it has some repetitive patterns which the child finds amusing. So if the nervous system feels calm and more inclined to attend to that sound, he might respond to it, yet fails to respond to the name when being called, because by calling him, first of all, it's not something that is rewarding to him. It's not something that is going to trigger dopamine pathways. So in most cases, when he hears like his name, of course, it is going to involve temporal, it is going to involve frontal, it is going to involve cerebellum, it is going to involve motor cortex, all for nothing. Let me put it like that. So for him not being able to respond to his name, you might look at it as if he's being rude But it's not because he likes it, it's because even us, other people, there are some kind of songs that you can hear while you are passing somewhere and even stop the car or stop while you were moving just to hear that song because it triggers some reward system in your nervous system. So when those reward nerves are stimulated, the brain goes quickly to respond to them compared to the sound which are not familiar to us. Let me give an example for like rhythmic pathways and right hemispheres. Those are the ones involved especially when you hear songs. And even children, some children you find he can sing songs but he can't repeat. Otherwise, he can't make a sentence of his own, yet he can sing songs. I also get asked that question by many parents. That's because even our brain uses different parts when the child is repeating song. In most cases, using the right hemisphere, is not using the frontal lobe or the temporal lobe, which are involved into speech processing and making speech. First, language processing and sound processing, then the information is given to the frontal lobe so that now the speech can be done. So this is different from when the child now listens to a certain song. When he listens to a certain song and sometime he repeats it, he's not making anything new. He's just repeating the same patterns which are stored. So you might find that your child, when he hears songs, he can respond quickly because they are going to stimulate the sensory nerves and even the reward pathways. But when you are talking to him, calling his name, even for a child to say a simple word as simple as mama, it involves all these parts that I've talked a lot about. The temporal lobe, the frontal lobe, the cerebellum, the ganglia, the nervous system, the body has to respond, which is very different when he hears something which is amusing. The brain put a priority on that and uses everything it has got to make sure that he responds to that. So it's not because he's rude, it's because the priority was given to that thing which is more amusing. So to improve your child's speech, of course you can use Kunga therapy, but also I would want you to have this book which explains the reason why your child may understand but struggles to speak. And also it contains what parents can do to improve their children's speech. So by understanding why is the reason he can hear a song and respond but not respond to name, and what can you do as a parent, you can be able to make improvement for your child, either using Kunga therapy or using different parts, different tips that we've talked a lot about in the book, which can help you improve your child's speech.